Thank you so much for joining us, Yael. Welcome to October 7. Could you please introduce yourself?
Yes, hello. I am Yael Halaas, MD. I am a facial plastic surgeon based in Manhattan, in the center of New York City. I am the president and founder of the American Jewish Medical Association, as well as a founder of the Global Jewish Health Alliance. And it's my sad pleasure to be with all of you here today and talk about the anti-Semitism we're seeing in healthcare. Focusing mostly on the United States, but certainly with global aspects as well.
Okay, so for someone who never heard about anti-Semitism in the healthcare, what does it look like?
Big starting question. So, many of us have become, and not just within the Jewish community, the communities abroad have become well aware of the anti-Semitism that we're seeing throughout the world. And many of us have really been focusing on the universities, thinking that it really is starting at the universities. And we see it also being propagated into the elementary school educational system. And unfortunately, we see political parties really compounding and unfortunately using it actually as a platform. But what most of us really haven't been aware of, and I think what is the most fundamentally frightening, is that it has entered into the healthcare space. And there's a number of people I see watching and from the UK. So this is certainly not a new story for you, nor is it in Canada or in Australia, where we see things as far as Jews and Israeli patients being denied treatment. We have Australian nurses pretending that they're doctors, but certainly in their nursing capacity, admitting that they have already killed Jewish and Israeli patients and will continue to do so at every opportunity they get. And unfortunately, we're seeing reported cases of this throughout the world and throughout the and indeed in the United States as well. So I'd say that's the most severe form of it, but we're seeing it in the guise of anti-Zionism, which is a virulent hate movement. To be completely clear, it is a undivided hatred to destroy Israel, and it rapidly manifests as harm to Jews. And we've seen this throughout history. This is something that, started in the Soviet Union and was shared throughout the Middle East and now globally, where it's just reframing Jew hate in a political form. It's just a political statement. And we've seen this throughout history. In history before, this is the great mutating virus of hatred. And honestly, this can be applied to people everywhere. It's a mutating hate. You start with a libel, and you can do it against any group of people, but the most obvious is look at the Jews who've been scapegoated for millennia. And you see this under the guise of anti-Semitism when it was just a racial hatred, and then you saw it under anti-Judaism when it was just, Jews are different and Christ killers. And now we see it in the form of anti-Zionism. And the anti-Zionism is manifesting throughout our journals. Again, UK, shining example. The Lancet has a 2-to-1 pro-Hamas versus pro-Israel history of publishing journals. And these are our most famous journals, our most well-respected journals. The British Medical Association has the British Medical Journal and has been rife, has even higher numbers. I think it's 13-to-1. So that's within our journals. We see it in the public health space. We see it where incredibly biased studies are coming out, calls to remove Zionists from medicine and from public health. We see it right now at the World Health Association meeting, where there is a campaign to throw Israel out of the World Health Organization. Only Israel. We have horrible players in this world. Russia versus Ukraine, anything was mentioned. Iran, nothing mentioned. But this kind of unilateral focus that all evil is Israel. And we've seen this time and time again. Other ways that it's manifesting in our medical schools, we have fewer admission of Jews to medical schools, and we see it also in nursing schools, we see it in healthcare schools. Um, and the Jews who are admitted, usually it's no more in our most prestigious schools that usually had, certainly when I graduated, we had like a 20%. Just offhanded, these are all anecdotal because nobody actually counted. You can count race, but you cannot count religion. So, but anecdotally, 20% of my class was Jewish, and that was 25 years ago. Now there's less than 2%, and the Jewish students are ostracized if they identify in any way as being a person of Israel. And I mean that either as an Israeli or as we are the children of Israel in every major Bible, Old Testament, New Testament, the Quran, we are known as sons of Israel, people of Israel. So if they identify in any way with Israel, they are literally shunned. We have medical students who the rest of the class will not speak to them at all, period. They've been kicked out of study groups. We have concerns about Jewish faculty being doxxed. We have reports of Jewish faculty and students hiding their Jewish identity. It's truly turning into a horrific scapegoating and exclusion. Other ways that we see it manifested in the curriculum, we have medical schools that are literally having their medical students bow down on their knees and shout "Free Palestine." We have multiple medical departments making statements against Israel, though they've never made statements elsewhere. We have boycotts of calls for boycotts of Israeli technologies and any participation with Israel. We have faculty from Israel being disinvited from our major organizations. We have major medical health organizations putting out statements against Israel. We have, where they haven't before, we have the American Medical Student Association. We have numbers putting out resolutions against. Often it's really amongst residents and students. But major medical organizations have had events, be it the American American Association of Child and Adolescent Psychiatry had bad events. We've had bad events at APHA, emergency medicine. It's really in every way that it can be manifested. And the reason I say that this is the most concerning, because think about it, if you really want to destroy a population, who better to mechanize and industrialize death than physicians? And we have the historical example of this. In World War II, in the Holocaust, everyone talks about it started in the universities. Okay. But you know where it really started? In healthcare. Doctors and nurses joined the Nazi Party earlier and in greater number than any other profession. Why? Why? Why do we see this disease more exuberantly in healthcare? Well, in general, we tend to be very liberal in healthcare. We tend to be very optimistic and open-hearted and open-minded. And we really love the idea that there can be a simple answer to a complex problem. We want it to be so true so badly. And unfortunately, high intellect correlates greatly with high bias. So we can be influenced. Our intellect does not save us. And we saw in Nazi Germany that doctors and nurses joined earlier than any other profession. It was doctors and nurses who started the euthanasias of the undesirables, the eugenics. It was doctors and nurses who created Zyklone B, who created the gases to actually have the gas chambers. It was doctors in their white coats who stood on the train platforms at Auschwitz and selected who was to go immediately to death and who maybe could survive a week or two longer. And then, of course, it's doctors and nurses who committed the atrocious experimentations on humans, Mengele. And it's actually from there that we have the birth of many of our institutions for World Health and many of our institutions for ethics. And amazingly, less than 16% of US medical schools actually even teach lessons of medicine from the Holocaust. So it's just an appalling combination of susceptibility, um, misplaced intellect, and unfortunately, knowledge that can be used to really harm and dehumanize and ultimately kill a population. And throughout history, we see doctors often being swayed or following dangerous paths. Many young people are quoting Fritz Fanon, a psychiatrist who thought it was okay to to use violence. That's not okay. Um, we Che Guevara. I'm half Cuban, half Argentine, and Che Guevara features in both countries. Che Guevara was a med school graduate, second in command of Al Qaeda, was a physician, Assad in Syria, a physician. So unfortunately, the prestige doesn't necessarily get used to good purpose. Indeed, very cynically and intentionally, it's used for harm. Um, so that was a long answer to the first question.
No, that's okay. You answered greatly. It's not too long. It's exactly everything we needed to know. In order to dive a little bit deeper, when we last spoke, you told me that the playbooks that we know historically are actually being used right now. Could you talk a little bit about that book that you mentioned?
Yeah, I mean, I was referring to Rudolf Ramm, which was sort of the German medical ethic books for for why it's okay to put the and the idea really of that time was that the German society, the German Volk or folk, the health of the German folk was the ultimate good, and the Nazi doctors, when you read Lifton and you read historians, they actually never thought that they were doing anything wrong. And unfortunately, we see that same exact influence today because what so often happens with Jews is that it turns into a virtuous hatred. It's a beast. It's an illness. We're a cancer in the society. Um, and the same thing is happening today. Jews now are being characterized as white oppressors, colonializers, every negative, whatever the major social harm is of the day gets put onto the Jew. And they're following literally the exact same playbook. I mean, exactly how it was carried out in Nazi Germany. The same is being done today. You have infiltration of our major organizations, of our major medical journals. I mentioned how the journals have become biased. Don't take my word for it. There's actually a review article on it from Iran where they note the success of the pro-Hamas narrative in the most prestigious medical journals. The editorial boards have really been compromised. And it's very difficult to publish on anti-Semitism or anything that remotely comments on something interesting from Israel public health world, to mention it in any of the to get it published in any of the major journals. And it's the exact same path is that you really focus on academia, and we see the same thing here. You focus on the major medical centers, you focus on the major prestige. We have seen our NGOs, most of our medical NGOs, Doctors Without Borders, um, and many more, to be infiltrated very specifically with a specific ideology which harms Jews. It was the exact same before. And it's often been commented in Nazi Germany that, why were there so many enthusiastic um, participants from the healthcare field? And it was often said it was because they were wiping out their competition. And, there is something to be said for that because Vienna in Germany had the most prestigious healthcare system. And they have actually never recovered their prestige. And they had the most prestigious, often Jewish healthcare physicians and healthcare leaders. And they wiped them out, which was very tempting for the competition because all of a sudden somebody who wasn't as prestigious was knocking out all the major Jewish competition. So that's one very cynical way of doing it, but it's viewing it, and unfortunately, in many ways, um, we see the same repetition, libel, the coordinated campaign, really, which began on October 7th at the same time, where you had all of the NGOs, the UN, prestigious journals coming out with an unbelievable amount of journal articles, statements, all, and there's been whistleblowers from the major NGOs stating that they're using the libel, particularly the libel of genocide in the healthcare field, uh, particularly very, very early on, even before Israel started their response. So it's the exact same playbook. And as we saw, it did not fare well. And how to counteract that, I think, is a major point of importance for all of us.
So, what do you think? How can we counteract that? Because we see that the other side is extremely coordinated, as you said, their campaigns are coordinated and they are very organized. So, are we organized? Is our side organized?
No, no. So, unfortunately, one of the major libels that they love to throw at the Jews is that we have this massive network that's, controlling the world, but we actually didn't. And that's mea culpa, and really shame on all of us because, really looking back at what was so unique about the Holocaust and yes, there are many unique, horrible things, but it was a physician-led genocide. That's that's why it was so able to murder millions of people so efficiently. And we totally seem to have forgotten that fact, don't publicize that fact, and didn't organize ourselves in a way to meaningfully make it so there would be a never again. And one of the shames on us, or in hindsight, how we really should have thought about this better, is the fact that there was no American Jewish Medical Association. We have many people in this group who are coming from other countries, so I don't mean to be a brash, egotistical American. Um, but we are a really large country, and we are really incredibly influential amongst the world. And the fact that we never thought, amongst every single other cultural, religious, ethnic group, we never thought that it was important to have a medical association. And when I say the AJMA, the American Jewish Medical Association, we're not just medical. There's no American Jewish Nursing Association, Public Health Association, none of the specialties. It's truly an unbelievable oversight that we weren't organized in such a way to make, even for positive reinforcement, so that our medical students could have a friendly place to go on campus for mentorship. There's so many just positive promotion and interconnectivity between all of our countries and Israel, and that we never thought that that was important, is shameful. The fact that we didn't have a global Jewish Health Alliance, so that we could all, in a very coordinated way, work together, share many of the same resources, create a good ethics curriculum, and make sure that it was widely studied and used. I mean, if you think about it, if there's a tremendous movement now, which I think all of us agree with, to stop racism, to stop hatred against all of these different groups. Sexism, let's stop everything. Let's stop all hate. That would be amazing. And you would think in medicine, you'd think in science, oh, well, let's look back at the longest case study that we have. Well, we have millennia of Jew hatred. And you think that we would have kind of studied or spent some time kind of cracking that code. Nope. So truly shame on us. So, so how do we do it? I mean, I'll talk about big ways, and I'll talk about small ways. So, one, I don't know if it's a big or a small way, was we needed an American Jewish Medical Association, and we needed a global Jewish Health Alliance. And it really started like many of our groups, grassroots groups, have started to be really effective using an Israeli technology, using WhatsApp. Um, we just started as I just started as U.S. doctors fighting anti-Semitism. I didn't know that it was going to be U.S. public health officials and chaplains and nurses and veterinarians and dentists, that all of us really needed representation. And that WhatsApp group grew to 1,000 people very quickly, and that quickly made me realize that we needed an AJMA and we needed the global Jewish health. Because how do we stop this? We stop this by uniting. And if you ask ChatGPT, and I have to tell you, the other side is using a lot of ChatGPT also. So if you just ask AI, why did the Jews fail in Germany? Actually, does anybody want to answer? I'll answer. Number one, unity. And it's funny because we have the Talmud, because we have Karl Marx and we have Rothschild, because we are literally Jews, literally are all of humanity. We have the left, we have the right, we agree, we disagree. It's kind of like an old Jewish joke, but unity is something that even in Nazi Germany they couldn't unite. There actually were German Jews for Hitler. That actually was a group. And we see this today. We have people on the far left, we have people on the far right, and nobody can necessarily have unity. But I am telling you all, we must have unity, and in unity in one thing. We are the people of Israel. It doesn't get more basic than that. And even with all of our Talmudic debates, and they were terrific debates for those of you who study Talmud, and for those who don't know what Talmud is, it is our study, our debates about the Torah, about the Old Testament. It is just arguments, because it is human to argue. It is human to have contradictions and multiple theories and multiple views. And honestly, that's why we get so scapegoated, because humanity has a very hard time. Humans have a very hard time living in this state of constant choice, constant conflict. It is challenging to be human. And who represents that better than Jews? But the one thing I will say about the Talmud is you have, multiple scholarly rabbis debating points, but it is always with the basis of respect. And I think that at some point amongst the Jewish people, we do have to recognize that we do exist and certainly are under threat. And I don't care what your political beliefs are, if you, an AJMA reflects that, because it's important to be bipartisan, which explains for the United States. We have only two parties. UK, Israel, you have so many parties, I can't even keep track. But one thing has to be clear is that destruction of Jews and destruction of Israel is a red line, and we have to be united. So that's the first thing I call for, and certainly within the AJMA, I want all of us to be united. If possible, I want everyone in healthcare to be united. And we need to be united globally, because the same very calculated propaganda campaign being used against us is being used against us globally, and we can share many of the same resources. We are few, but we are mighty. We have good brains, and we do have allies. So it's not even a matter of being unified across our countries, but being unified with others who think that scapegoating is really wrong. And if they really question social justice and they really question hatred amongst other people, well, then why are you allowing hatred against one group? Why are you, and we see this continuously, Jews are being kicked out of many of the liberal spaces that they helped create, unions, a lot of the social justice organizations, many founded by Jews, are being kicked out because all of a sudden it's okay to hate Jews. Well, it's not okay. And so unity is incredibly important. I think I briefly saw in a comment, someone wrote something about legal. So yes, so the other way that Jews in Germany failed is they were stripped of their legal rights. So we absolutely have to use legal while we absolutely can. And we see that in many legal cases. There's recently been a couple in the UK where it's actually being legitimized to hate Jews. It's okay. So we have to avail ourselves of unfortunately lawfare as it is being used against us.
It's
And finally,
yeah.
and finally, number three is legislative, and that is the government. And certainly in the United States, that has been a powerful tool, perhaps at times controversial. Well, actually, I wouldn't say controversial because it shouldn't be controversial that our government is standing up for human rights and civil rights. So that really shouldn't be the controversy. What perhaps is the controversy, certainly for healthcare, is, and early on in forming AJMA, I thought, wow, my gosh, if we threatened, as we have for other groups, NIH funding or Medicare or Medicaid because of discrimination, there wouldn't be a single institution that would allow their research funding, their Medicare funding, their Medicaid, their patient funds. No institution would ever allow that. Of course, they'll jump right in and say, "Oh my gosh, this is terrible." Well, I'll jump in. Irony on me, on all of us, is that actually wasn't the case. Many institutions, rather than actually question whether they had an issue with civil rights, kind of allowed the funding cuts. And listen, there can be controversy on maybe Trump jumped in sooner and maybe what happened when. But certainly that was my feeling is that somebody who's dedicated their life, and many of us who've dedicated our life to healthcare, is that no healthcare person would ever let the funding, certainly to allow civil rights discrimination to continue. But that certainly is a big, scary lever to institutions and can hurt a lot of us because we don't want patients to lose their care. We don't want to lose our funding. Many Jews are researchers. So it's really an unbelievable state that we find ourselves, that our institutions are at risk over civil rights for Jews. So those are the kind of the big levers, kind of very big sticks, but also hopefully carrots by having our unity, by being organized, which sadly we weren't before. We really can provide a warm, wonderful environment and really point out how much we bring to healthcare. So those are the three really important.
Amazing. Thank you so much.